You're in the session, What You Need to Know About Age-Related Macular Degeneration with Dr. Mark Mandell. Dr. Mark Mandell, we're so thankful that he's here with us today. He is an ophthalmologist at St. Michael's Hospital, and he's also a lecturer at the University of Toronto in the Department of Ophthalmology and Vision Sciences. Dr. Mandell provides community-based care for people that have retinal conditions, and he recently founded the Mississauga Retina Institute. And so we're so happy that he's here to talk with us today. So without further ado, Dr. Mandell.
Thanks very much. I want to first thank the Foundation of Fighting Blindness for inviting me to speak today. And I want to thank everyone for coming. I see a lot of familiar faces, and it's really nice to see everybody today. Age-related macular degeneration, or AMD for short, is common, but it's also a misunderstood condition. And the goal of my talk today is to really help you understand AMD, the risks, the causes of AMD, and what you can do to help prevent vision loss. And I'll speak for about 20 minutes, and we'll try and leave a lot of time at the end for questions. So if you have questions, try to remember them, and we'll make sure we touch on all of them. I'm going to frame the talk today really into a series of questions, and patients often come into the office and have a variety of questions about AMD, or family members of people with AMD have questions, and so I'll try to frame it in the kind of questions that I would often get in the office. So the first question is AMD common? And AMD is the most common cause of severe vision loss in people over 50 in Canada. It's 4 times more common than Alzheimer's and Parkinson's combined. And over 2 million people in Canada have age-related macular degeneration, so it's very common. And about 80,000 new cases of macular degeneration are diagnosed every year. And these range from very minimal vision loss to people who have more severe vision loss. And AMD is primarily a disease of aging. So in people who are 55 to 65 years old, about 14% have macular degeneration. In those 65 to 75, 20% of people. And in people over 75 years old, 40% of people have some macular degeneration. So it's a very, very common disease. And with our aging population, the number of people affected by AMD is only going to increase. So what is AMD? I think the first thing we have to do is step back and talk a little bit about parts of the eye and what AMD affects. So at the front of the eye, you have the cornea. And the cornea is clear, and you can think of it kind of like the window at home. The cornea, light travels through the front of the eye or through the cornea. And then light hits the lens. So like a camera, your eye has a lens in the middle. And that bends light towards the retina. And the retina is the tissue at the back of your eye that receives light and transmits it to your brain. So that's the retina at the back of the eye. The middle of the retina, the very center, is called the macula. So the macula is part of the retina, and the macula is the part of the retina that gives you central vision. So it's what lets you read, see the television. The center of your vision is important for driving. It has lots of important jobs. It helps you see detail. The macula helps you see color, and importantly, lets you see faces. Now, people often wonder with macular degeneration, or they worry, will I ever lose all of my vision? And this is obviously a concern. Now, I want to tell everybody, you'll never lose all your vision from macular degeneration. So even in the worst case, you never go blind, as in the world never goes black. The middle of your vision can get worse, certainly, and there are things we can do. We'll talk about how to prevent that, but no one ever loses all of their vision from macular degeneration. Now, what is the impact of macular degeneration? Well, it can be significant. AMD can cause loss of visual function and decreased mobility. It can cause an increased risk of falls, especially hip fractures due to falls, and this can be related to poor vision. Some patients can lose their ability to drive, and that can affect people's independence. And loss of one's sight can also affect mood, and certainly there's a high rate of depression among those with serious vision loss from macular degeneration. Now, another question I often get is, if my parents have macular degeneration, what's the chance that I'm going to have it, or am I going to get macular degeneration? And who gets AMD? Who is at risk? Well, there's a variety of risk factors for macular degeneration. The most prominent one is increased age, but there are other risk factors also. Being a woman puts someone at higher risk. Having light eyes and light skin, you can think of it as like people who have very light skin are more likely to get skin damage from the sun. It's the same sort of thing with the retina. People who have light eyes and light skin, their retinas are also more sensitive to the sun and to UV, ultraviolet. And genetics is also important. We know that in about 50% of people with macular degeneration, there is a familial component or a genetic component. And smoking is also an important risk factor, and this is one of the few risk factors that's actually modifiable, meaning you can do something to reduce your risk of worsening macular degeneration or reduce the risk of getting macular degeneration. A smoker has 4 to 6 times the risk of developing macular degeneration compared to someone who doesn't smoke. And someone who smokes will get macular degeneration roughly 5 to 10 years earlier than someone who doesn't smoke. So smoking is a really important risk factor. Now, another question often I get is, how would I know if I had macular degeneration? At the earliest stages, you may not know. Often there isn't any visual loss or anything you would notice until more advanced stages. But it's very important to get regular eye exams as we get older. And your eye doctor will do some various things to figure out or see if you have maybe early stages of macular degeneration. They'll ask you a variety of questions to assess what is your risk. They'll examine your eye, check your vision on the eye chart, usually put eye drops in to dilate or enlarge your pupils, and then they'll look in the back of your eye with various microscopes to see if there's any damage to your retina. There's also testing sometimes we do to look in your eye and see if there's any evidence of macular degeneration. So one of the new technologies that's been around for over 10 years is called OCT, or optical coherence tomography. And who in the audience has macular degeneration? Can I just see a show of hands? Okay, so probably more than half the people in the audience. Well, if you have macular degeneration, a lot of you have probably had an OCT before. Usually when you go to the eye doctor, you'll sit at a machine, and a machine scans the back of your eye. And you can think of it sort of like ultrasound, but where ultrasound uses sound waves, an OCT machine uses light waves to scan the back of your eye and create an image. Another sort of technology often we use in macular degeneration is called fluorescein angiography. And this we do less frequently nowadays, but this is a test often done in the hospital where you have vegetable dye injected into a blood vessel in your hand, and the dye travels to the back of your eye, and we take photos. And looking at the photos, we can assess if you have macular degeneration or what stage you might have. So this is another test some of you may have had. Has anyone had a fluorescein angiogram before in the hospital? Okay, so a lot of you. So another question I get is, what are the types of macular degeneration? So again, macular degeneration is a degeneration or a breakdown of the central part of the retina, or the macula. That's the center of the retina. And there's 2 types. There's dry macular degeneration, and there's wet macular degeneration. The dry type is the most common type. So 90% of people who have macular degeneration have the dry type. And this is really an aging change in the back of the eye. And you saw the video here, but if you think of your retina as like the sidewalk, dry macular degeneration is like the sidewalk breaking down over time. And waste products, in the eye we call them drusen, can build up in the back of the eye. From dry macular degeneration, the center of your vision can get worse, but if it gets worse, it's usually very gradual, over months to years. And some people don't lose very much vision from dry macular degeneration, and some people can. They can actually lose a lot of central vision. But again, as long as you have the dry type of macular degeneration, any changes are usually very gradual. Now, there's also the wet type of macular degeneration. So this is less common. It's about 10% of people who have AMD. And everyone starts out with dry macular degeneration, but a small subset, about 10%, it can turn into the wet type. Now, so what is wet macular degeneration? Well, if you have dry AMD and the back of your eye is getting weaker and the tissue is degenerating, if it gets weak enough, small little blood vessels that are supposed to stay sequestered behind the retina can break through the back layers of the retina where it's weak, and the blood vessels can start to grow like little weeds. They mentioned that video. And little blood vessels can grow under the retina or inside the retina, and then they can start to bleed or leak. And your retina is usually supposed to be relatively flat. But if you get little blood vessels growing in the retina or underneath, and if they start bleeding or leaking, the retina becomes distorted. So it becomes wavy, you get elevations in the retina, and this causes a change in vision. So one of the first changes people often notice in wet macular degeneration is that straight lines tend to become wavy. So if you looked at a door frame or anything, look at blinds at home, you might see that straight lines are starting to become distorted or wavy. The other thing is people often see is they start to lose parts of their central vision. So you might get black areas or gray areas in the center of your vision that you can't see well anymore. If left untreated, these little blood vessels growing in the back of the eye, as they leak and bleed, eventually scar tissue can start to form in the center of the retina. And at this advanced stage, there isn't necessarily treatment we can do to help. I'm going to talk more about treatments and things we can do. So the important thing really with wet macular degeneration is to catch it early, before advanced stages set in. Now, just a show of hands, who's heard of an Amsler Grid before? Okay, so maybe half of you. So an Amsler Grid is a diagram, and it's made up of a series of horizontal and vertical lines. And it's often given to patients who have macular degeneration. And I see from some of you, I think some of you have some in booklets on the table. An Amsler Grid is often given to people who have macular degeneration. And it's a way to monitor your macular degeneration and try to catch it early if it ever changes from the dry type into the wet type of macular degeneration. Now, just another show of hands, who knows how to use an Amsler Grid? Okay, so again, more than half of you probably. So an Amsler Grid, I'll go for those of you who don't know what it is or how you use it. It's this grid, and it has a series of horizontal and vertical lines, and what you would do is hold it up in front of you, and wearing reading glasses, you hold it about a foot away from your eyes, and you would cover one eye and look at it, and you want the lines to be fairly straight. Even with dry macular degeneration, you can get a little bit of distortion in the straight lines, but the lines should be relatively straight. Now with an Amsler Grid, if you look at this on a regular basis, and you ever notice that the straight lines start to become very wavy, or you notice that you can't see portions of the Amsler Grid anymore, this is a sign that you may have bleeding or leaking in the back of the eye, and dry macular degeneration may be changing into the wet type. And the important thing, the reason why people use an Amsler Grid and check their vision regularly, is because if you have dry AMD, changes are very gradual. If it ever turns to the wet type, there's treatment we're going to talk about, but you need to catch it very early. Often people lose vision in one eye, and they don't notice because you use two eyes together. And so you can lose vision in one eye, and months can go by, and you don't realize that one eye's actually gotten worse and may have turned into the wet type of macular degeneration. Now, if you're checking your eyes regularly, one at a time, with something like an Amsler Grid, hopefully you would notice that one eye is actually getting worse, and you'd get seen quickly. Now, moving on a little bit, another question people often ask is, can you treat the dry form of macular degeneration? So that's the earlier form that most people have who have this. There's no good treatment yet to reverse dry macular degeneration and bring back vision that's already been lost. But there are a variety of things you can do to prevent dry AMD, or if you have dry AMD, to reduce the risk of it getting worse. So diet is a very important thing. We know eating lots of leafy green vegetables, orange vegetables, also eating fish once or twice a week, all these things we think may reduce the risk of developing AMD, or if you have it, reduce the risk of it getting worse. Wearing dark sunglasses is also very important. We know ultraviolet light or sunlight can damage the back of the eye, and wearing dark sunglasses is certainly a good idea if you have macular degeneration, and even if you don't, if there's a family history or you're concerned about it, wearing sunglasses outside is a very good idea to try to prevent any problems. There are also a variety of vitamins meant for your eye, so pills you take that may reduce the risk of macular degeneration. And there's good research that if you have macular degeneration and it's at a certain stage, taking these ocular vitamins may reduce the risk of it getting worse. Vitamins aren't perfect, and even taking your vitamins every day your AMD can still get worse, but it lowers the risk. And the other risk factor we spoke about is smoking. So smoking is probably the most important preventative measure. For those of you who smoke and have macular degeneration, quitting smoking is the best thing you could do of all these things. Now, what about wet macular degeneration? People often want to know, is there a treatment for wet AMD? And if I have wet AMD, will I go blind? So as I mentioned before, no one goes completely blind from macular degeneration. AMD only affects the center part of your retina and the center part of your vision, and so you never lose all of your sight from AMD. And the good news is, nowadays there actually is good treatment for wet macular degeneration, and good treatment to prevent worsening vision, and in some cases, actually bring vision back that's been lost. Now, before we discuss the treatment in 2014 for wet macular degeneration, I want to take you back a little bit and tell you about the treatments we've had in the past and how far we've come. So I mentioned that wet AMD is a disease where small little blood vessels behind the retina can start to grow, and they can grow into the retina and underneath the retina, leaking and bleeding, leading to vision loss. In the past, one of the main treatments we had was laser treatment, or thermal laser. This was a laser that conducted heat to the back of the eye, and the idea was to try to seal the little blood vessels that were growing and leaking in the back of the eye. And the laser worked well at destroying these little blood vessels that were growing. The problem was the laser was actually very destructive, and it would actually leave large scars in the back of the eye. Laser is not a great treatment. We couldn't use it for people who had wet AMD right in the middle of their vision because the scar left behind would cause more damage than good. Furthermore, very few people ever gained good vision with thermal laser, and a lot of people, more than 50%, despite treatment, still got worse. So it wasn't a great treatment. In 2002, a second form of laser came about called photodynamic therapy, or PDT. Has anyone in the audience had PDT before? Okay, so there's a handful. So the idea of PDT, unlike the laser I just mentioned, PDT was a cold laser. And that means it didn't heat up the retina too much, and it wasn't supposed to cause any scarring. The way it worked is that we'd inject a dye, or a molecule called visudyne, into a blood vessel, and it would go up into the back of the eye, into these abnormal blood vessels that were growing. And then we'd shine a special laser light on the back of the eye, and it would activate the drug in the back of the eye and try to shrink the little abnormal blood vessels that were growing in wet AMD. And it worked much better than the lasers we had before, and it decreased the risk of vision getting worse. But like the laser I talked about previously, not a lot of people got better vision with this form of laser. Now, in the last 10 years, and since PDT, there have been major developments in wet macular degeneration treatment, and patient outcomes have dramatically improved in a lot of people. And this is largely because of a new class of medicine. Yeah? Oh, sure. Thank you. We've got a few minutes left, and then we'll get to questions for sure. A new class of medicines called anti-VEGF agents. And I'll step back and give you a little bit of information about it. So, vascular endothelial growth factor, or VEGF for short, is a naturally occurring molecule in your body, and it causes new blood vessels to grow. VEGF has some important roles in our body, but can also play a role in diseases. For example, VEGF plays a role in cancer in that it helps little blood vessels grow and let cancers grow. And to treat cancer, a class of medicines called anti-VEGF agents were discovered. And these medications would actually shrink little blood vessels growing in cancer, and as a result, cancer would shrink and regress away. And someone discovered that if we actually inject these medicines called anti-VEGF agents in the eye, we could actually shrink the little blood vessels at the back of the eye, just like they were shrinking little blood vessels in cancer. And so treatment was started for wet AMD using these kinds of medications to try to shrink blood vessels growing in wet AMD. So originally we started using Avastin, and this was a medicine used to actually treat colon cancer, and by injecting it in the eye, we could actually shrink the little blood vessels in wet AMD. And not only did people's vision not get worse, but a lot of people actually gained vision. Based on this colon cancer medicine Avastin, a new drug was developed called Lucentis. And this is a medicine actually designed for the eye with the same goal, to try to shrink little blood vessels growing in wet AMD. And unlike the treatments before, most people getting these anti-VEGF injections would not lose further vision if they're getting treated. And a lot of people actually got an improvement in vision with anti-VEGF injections. Now, the last thing I'll mention is questions about Lucentis treatment. So how is Lucentis administered? Is it painful? And how long will I need treatments for? Well, before treatment with anti-VEGF agents, Avastin or Lucentis, or I'll talk about another one called Eylea, the eye is frozen or anesthetized. So usually eye drops are given to freeze the eye, or sometimes a doctor will use a small needle to freeze the eye. And this is not painful. Then a very small needle is used, and a small amount of medication, less than a teardrop, it's a very small amount, is actually injected through the white part of the eye, or the sclera it's called. And this is injected into the back chamber of the eye called the vitreous. And we call this an intravitreal injection. Most people feel some pressure during injections, but most people don't feel significant pain. And the medication travels through the vitreous, or the back part of the eye, to the retina. Most people, when they start treatment with anti-VEGF injections, they get injections every month for 3 months. And after that time, we tailor treatment usually to the patients. Some people continue to need injections every month to prevent their vision from getting worse. And other people need injections much less frequently, or not at all. And again, treatment prevents worsening in vision in about 90% of people getting injections. And about 40% of people actually gain significant vision with anti-VEGF injections. Now, these injections are not a cure. And like I said, only really a minority of patients only need a few injections. A lot of people need treatment on an ongoing basis. I always explain it's sort of like blood pressure medicine. A lot of you, who takes blood pressure medicine? So if you take blood pressure medicine, you know you have to take it on an ongoing basis. If you don't take your medicine, your blood pressure goes up. Well, it's the same sort of thing with these anti-VEGF injections. It's a medication, and just like any other medicine, a lot of people need it on an ongoing basis to keep things under control. So the very last thing I'll mention is new treatments for wet AMD. And there's going to be a separate session about this a bit later, so I'm not going to go into much detail. But I'll just mention Eylea is a new anti-VEGF medicine like Lucentis, and it's going to be covered by the government shortly. It's not yet. But the idea is that it works very similar to Lucentis, and we're hoping that it will last longer in the eye, and we may need fewer injections. There's another class of medicine also called platelet-derived growth factor, and this is a whole new class of medicines, and we think it may play a role in preventing scar formation. And this has been one of the problems in wet AMD, that with advanced disease, bleeding and leaking in the eye can turn to scars, and this we can't help with medicine. And the last thing is dry macular degeneration. And up to this point, wet macular degeneration has been a bulk of the patients who had poor vision loss had wet AMD. Well, as we have better and better treatments now for wet AMD, we're actually finding patients with dry macular degeneration are taking up a larger and larger percentage of the population who have poor vision. And so there's a lot of research now into treatments for dry AMD. And there'll be more discussion about that later, I think, in one of the sessions. So that's it I wanted to touch on. I just wanted to really explain some of the basics about macular degeneration. And again, there'll be sessions later breaking up into about nutrition. I think there's a session on emerging therapies. But if you have any questions, I'd be happy to answer.
Can you have one eye that has wet and one eye that has dry?
For sure. So people who have macular degeneration, it usually exists in both eyes. So it's uncommon to have AMD only in one eye. And in everybody, macular degeneration starts out as the dry type. So if you have dry AMD in both eyes, certainly one eye or both eyes can turn into the wet type at some point. But you can definitely have dry in one eye, and the other eye it can change from dry into the wet type. The important thing is to make sure it doesn't change in the other eye, and if it does, to catch it very early so you can treat it and prevent vision loss.
Thank you. I have wet macular degeneration, and I find that flashing lights and all these digital apparatus are really hard on my eyes. I also have a great-grandchild with light eyes and light skin who is constantly being taken, her picture is constantly being taken. Is this, could this affect her eyes?
I guess the short of it is that we know exposure to ultraviolet light, a lot of sun, especially people who have light eyes and light hair, light skin, are probably at higher risk. So if you're a younger person and you have a family history of macular degeneration, certainly wearing sunglasses outside, just like you'd wear sunscreen if you had light skin, wearing sunglasses as much as possible is a good idea. Photography, I think exposure to extremely high amounts of light is probably not a good thing if you're at risk of macular degeneration, but I wouldn't worry much about photography in itself.
My question is about sunglasses. Should you wear them year-round, whether it's a sunny or cloudy day, number one? And number two, what about the new color lenses that some ophthalmologists are talking about, that the yellow or the pink lenses might be as useful as the dark ones?
Sure. So, I think it is important to wear sunglasses year-round. A lot of people think it's only important in the summer when you can see the sun. But in the winter, a lot of sun reflects off the snow, and you can also get exposed to a lot of ultraviolet light in the winter as well. And even on days when there's clouds, there's still a lot of ultraviolet light that gets through. So I think certainly if you have macular degeneration, it's a good idea to wear them. Not necessarily on the darkest day outside, but it's a good idea to wear them outside a lot of the time. And for sure if it's sunny in the summer or winter. In terms of colored lenses, there are different colored lenses available, and some offer better contrast. So one of the problems in macular degeneration is people's contrast sensitivity can get worse. And so some of these lenses can help with that. I think the important thing is to make sure no matter what sunglasses you're wearing that they have very good UV protection, no matter what tint they are. You'd have to check which specific ones you're looking at and just make sure they have good UV protection.
Yes, I have a question. About 40 years ago, I developed dry in my left eye. And I was told at the time that that was due to work stress and lifestyle and things of that nature. And I did change my lifestyle. And, of course, I still have the dry. 3 years ago, I got wet in my right eye. So now I have the matched. I have both kinds. Is it true that dry can become a problem if you're working under stress or living under a stressful condition?
Stress alone, we don't think causes macular degeneration, but there are a variety of risk factors, and certainly exposure to light and people who have maybe lighter skin can obviously put you at risk. Diet can play a role. So there are lots of risk factors, but stress alone and using your eyes doesn't put you at higher risk of macular degeneration. It's a good question because a lot of people with AMD, I think one of the big fears is I'm having trouble seeing the television or reading books, and if I use my eyes, is it going to get worse? And it's not. So if you have macular degeneration or you're at risk of it, using your eyes for difficult work, watching television, reading as much as you'd like, none of these things cause macular degeneration or cause it to get worse.
Hi. My question is actually, again, a follow-up on sunglasses. I'm just wondering, because I have seen some fairly expensive sunglasses that say they protect against UVA and UVB and or a variety. And I've also heard that there's a lot of sunglasses sometimes coming out of China that say that they protect but don't really. So do you know of a reliable source on the internet or brand or something so you know that you're really getting good sunglasses? And is the UVA, UVB protection both important?
So I think protection from UVA and B are both important. I don't know of an internet resource to tell you which brands are probably more reliable than others. But most brand name sunglasses in Canada anyway, I think if they say they protect from UV, I think it would be reliable. I think if you have macular degeneration, it's a good idea to make sure you're wearing some sort of brand name, and I would trust that it has good UV protection.
And again, I'm so sorry that we don't have time to take all of your questions right now. It's just important for us to kind of stay on time because we have a really exciting day planned today. And so if you want to be a part of the next breakout session, which is Emerging Research and Treatments for AMD, you should stay in this